So, we're going to continue our series on DKA and actually go into the treatment of why we do things. So, if you remember, these patients are actually in hypovolemic shock from severe dehydration, and that's because of the osmotic diuresis that occurs. So, the first line treatment is actually to give fluid. We have to replace that volume that was lost because our organs aren't getting the perfusion that they need because they're in hypovolemic shock. So, the first line treatment is actually fluid resuscitation. The next thing we have to worry about, and really it's one of the first things we think about as well, is what our potassium actually is in these patients. The problem with DKA patients is that no matter what, even if my potassium level is high, my total body potassium is actually depleted. So once we actually start fixing the problem, our potassium levels will drastically change. And you're like, how can my total body potassium be depleted when my levels are really high? Well, acidosis actually causes a rise in the potassium level. And it does this because it's shifting potassium from inside the cell to outside. So that value will actually look higher, even though the total potassium is actually depleted. The other thing we have to remember with potassium is once we start to treat, so even giving fluids, but definitely insulin, what we're going to start doing is we're going to fix that acidosis, right? And we're going to cause the potassium to shift back into the cell. This is going to drop that potassium level. This is why it is so important to make sure we're monitoring and checking potassium levels before we ever start treatment. So what we typically are going to want to do is actually give potassium even if our potassium is around 5, because we know that we're going to shift that potassium back into the cells and then drop it, which can cause major issues for our heart like arrhythmias. So everyone thinks we give insulin to lower the sugar, which is true, but the actual reason we're giving it is to kick these patients out of metabolic acidosis. Because you remember, they're breaking down fatty acids, which are forming ketones, which is creating this massive acidosis in these patients. So we're actually giving insulin to switch back to that normal fuel source of glucose and get these patients out of acidosis, not just to lower their blood sugar. We also have to talk about when we actually add dextrose because this is really important. You would think that we would just give insulin until our sugar is normal. But again, remember, the reason we're giving insulin is to stop that metabolic acidosis that's going on. So really what we need to do is continue to give insulin. But if we did that, we would drop our sugar too low. So essentially we have to add dextrose to these patients' fluid in order to maintain a normal sugar. Check out our next video where we're going to review an actual CCRN question on DKA.